parasternal short, the probe direction towards left shoulder. Okay, left shoulder, and then that means you start from the parasternal long, and then you rotate 90 degrees. Okay, the patient left shoulder, so it will translate the heart is perpendicular to the left axis, the long axis. So it's almost like bread slicing. Okay, you slice the heart in different areas. So the levels, one is the pulmonary artery level, then the aortic level, the mitral valve level, pulmonary muscle level, and apical level. Okay, apical level. So this is a probe direction rotated to left shoulder. So as you see here, you start from the pulmonary level. So this is a pulmonary level. So probe direction. Okay, you move a little bit higher up. Okay, start it higher, and then you go down. Okay, you just move down, and then aortic valve level, mitral valve level, and then the posterior papillary muscle level, and then the apical level. As you cut the heart from the longitudinal to the transverse in each level. So when you say here, this is the pulmonary artery level 1. Okay. So as you see here, this is the aorta. Okay. This is the right atrium, the right ventricular flow tract. Then it goes to pulmonary tract. Pulmonary tract, you will have two, right? The right and left. Okay. This is the right, and this is left. So this level is pulmonary level. Okay. Pulmonary level. Next is this is the aortic level. So this is Mercedes-Benz sign. You know Mercedes, right? Yeah. So the Mercedes-Benz sign. So these are the three coronary cusps. Okay, right, left, and then coronary cusp. Right atrium, left, right ventricular outflow, then left atrium. So this is what you see in parasternal short while you are looking at the aortic level. If you go down, a little bit down, then you will reach to the mitral valve level. So this is the mitral valve. The inside part is the mitral valve, and this is, what is this? So this is the left ventricle, and this one, this is the right ventricle. Okay, the right ventricle. So this should be circular, and this should be C. Okay. In the normal scenario. Then inside you will see the mitral valve. Okay. So the mitral valve can be calculated. The area can be traced. Then if you reach to the posterior, papillary muscle level, you will have right and left papillary muscles. Then you will have the left ventricle, right ventricle. Okay. So these two can be used for correlating the right and left sides. Okay. Or any pressure on the left ventricle. And this is apical level. The apical level. Only you see. So which level is this? Pulmonic? Mitral? Where is the mitral one? Okay, so this is a left ventricle, and this is artery. And you have somewhere here a mitral valve inside. It's going down to the papillary level. Okay, just from the higher person. Listen on. So let's start from the pulmonary level. Okay, pulmonary level. This is what you see in the echo. It's a little bit difficult to see the pulmonary level because it's higher up. Okay? So you need to go higher up like this. You need to move. Your probe should move like this. So you easily can. You should start from the aortic level because it's easy to find the aorta. Because they're clearly defined Mercedes-Benz side. Then you go to the right atrium, then the right ventricle. And now we go to the pulmonary valve, and then right and left pulmonary artery. So this is a pulmonary regurgitation jet. So you can measure the diameter here. Okay, you can see the size of the pulmonary trunk. Okay. You can estimate, and then look for pulmonary hypertension. Down here, this is what level? Aortic, right? You have Mercedes-Benz signs. Okay, the right and coronary and left coronary. What is this? Right atrium, then right ventricle. Okay. Then it goes to the pulmonary. Left atrium, right atrium. So this is what you see on the aortic level. Okay. Down here is a mitral valve. This is difficult to see, but the inside this is a mitral valve. Okay. And this is the left ventricle, anterior leaflet and the posterior leaflet. Is it going on? Is it going on? Sometimes it will happen. Huh? You don't see anything. What about now? Okay. So if you get a good heart, then you see this. So you'll have a left ventricle here. Okay. Then the mitral valve is closed. Okay, then closed. And then the right ventricle is C-shaped. Sorry. Papillary level, you will see the cords, papillary muscles down here like this. So you need to be careful. Sometimes people say this is thrombus. You just see one view and then there is a big thrombus moving around. Okay, you need to move down. You need to look from other direction. So this is a papillary muscle. Okay. Here also same. Okay. So you have right anterior and posterior, and then you have LV, a little bit RV. Now it comes only the apex. Okay, it's almost the same as previous. So here you see only anterior, lateral, inferior, and septal one. You don't see the posterior or the apex. But in the others, you will see all ladies purchase in Shwadapu. ALPIS. Okay. All that means anterior, lateral, posterior, inferior, septal. Okay. So you look all motion abnormalities in these areas. So if you see here, that means anterior. If you see over here, this is lateral. And if you do this here, inferior. Sometimes when you go higher up, you see the posterior. And then the septum. Okay, septal. So this is the septal function. So things that you see on 2D of parasternal short axis, you can look at the aortic valve, you can start the aortic valve area, okay, tricuspid valve. You can see velocities, regurgitations also, you will see later, and also pulmonary bifurcations. Mitral valve area can be calculated, okay, mitral valve area, and you can look also the papillary muscles, the apical level can be assessed, okay. So this is a things that you should assess on parasternal short axis. So the parasternal, so you see parasternal long and short. Now let's say the apical four chamber. So probe direction towards. So probe should be placed in the area of PMI. Okay. So it's possible to better to find the PMI first. It will be easier than to scan if you find the PMI. But otherwise, you can start from lateral angular line. Okay, then you can come anterior. You scan and then you come anterior. So this indicator to patient right is for while you are reading emergency view, look for the right hip. For the right hip. What about cardiologic view? Then toward 3 o'clock. So this is towards 3 o'clock. So this is what you see. Okay, this is what you see. It's labeled here, but how can you differentiate whether it is right or left? Indicator, right? So the indicator, look the indicator and then echo. Yeah, so this is echo probe. Then, so it's almost similar to FAST. If you remember while you are doing FAST, you make the right side to the right is because you find the right structure on the right side. Okay. Now, if you make echo, the importance is if you place on the left side and then probe direction on the left, things on the left are the left. That means the left ventricle and the left atrium is on the left side. Okay. But if you use the abdominal probe and then the probe direction is here, do you think the image will reverse that way?
No, not same.
Yeah? So this should be the proper image that you should find while you are doing apical fourth chamber. Okay? So that means it shouldn't be narrowed or shortened here, and the septum should be perpendicular. So say the base apical. Okay? The base apical should be perpendicular, and then the apex shouldn't be shortened. Okay? So you look for right and the left ventricle, right and atrium and left atrium, the valves, the mitral valve, the tricuspid valve, okay? And then the interventricular septum, interatrial septum can be assessed. The size for right and the left can be compared. Okay, atrial enlargements can be assessed, or Doppler democradin. You can assess also regurgitation in the leg. Okay. So same apical fourth chamber, right, left ventricle, right atrium, left atrium, tricuspid valve, mitral valve. This is a cadaveric view. Okay. So this is what do we mean by foreshortened or shortened left ventricle. If you don't have the proper LV, like you don't see the proper apex, okay, clean apex, so it will be shortened and then it will look like ellipse. Okay. So you should have a longitudinal and properly visible LV. So the problem of finding this is, especially for the cardiologists, if they are using ejection fraction assessment using Simpson, okay, then the volume area will be shortened, so the ejection fraction will be depressed if you don't get the proper the whole in the left ventricle. So left ventricle apex and then the interventricular septum. This is anterolateral wall of the left ventricle, and this is tricuspid valve, mitral valve, sorry, and left atrium, interatrial septum. Okay, and then here is the descending aorta. Sometimes you may see the right pulmonic vein somewhere here, so don't be confused. So this is a mitral valve, so you have a medial annulus and the lateral annulus, okay, a base of the mitral valve, and then these are the leaflets. So what are the things you will assess? Okay, so you need to adjust the depths. For shortened in dino, depths on adjust the color Doppler can be used persuasive or continuous loop Doppler, and as you okay, so different color modes, regurgitation or stenosis can be assessed. Sometimes you can do apical 5 chamber using apical 4 chamber. You just rotate your probe direction, okay, a little bit to look for the aortic valve. Okay, you see. So more of you rotate it a little bit to anti-clockwise. You are 3 o'clock, right? You just move a little bit around and then fan. So you look the apical 4 chamber. That means the aortic valve. So this is aortic valve. When you open it, so you will see the aortic valve. So this is apical 5 chamber. Same apical 5 chamber, aorta, okay, LV outflow tract, apical 5 chamber. Subxiphoid, easier to do, okay, because you accustomed with fast probe direction towards left in echo, but right in others, emergency. So this is what you see, okay, right atrium, right ventricle, left atrium, left ventricle. So what are the things we can see from here? Yes? Yeah, pericardial fusion can be easily identified. You can also compare right and left. Okay. Or you can also look for defect. Okay. Atrial or ventricle. Can be assessed. It's easy to find, but sometimes it will be dangerous. Okay. If you move your direction like more of posteriorly, so the posterior one is left ventricle. So you will say left ventricle, right ventricle is greater than left ventricle. There are many reports. So because if you move it more of posteriorly, the thing that you will see in me is the posterior one is a left ventricle. But you need to look towards looking the chin. Okay, if you need to do from subxiphoid like you are scanning towards the chin. Subxiphoid, right atrium, right ventricle, LA, and then LV. Okay, then different valves, tricuspid and mitral valve. Same liver here. Okay. So you can assess ASD with the also right ventricle or TR, IVC can be assessed. Okay. So you can do longitudinal or transverse from this view. And also hepatic veins. Okay.